After washing your hands, you want to prime the needleless connector with saline. I highly recommend retracting the needle out and inward a bit before needle insertion to ensure smoother needle retraction, because sometimes I find that this can become stuck. In preparation for this needle insertion, I've been having a glove with warm water sit on top of the patient's foot. Warm water increases vasodilation and therefore the veins will become larger. I recommend feeling the veins with clean hands before putting gloves on. A good vein that is commonly used is located on the inner ankles. I will not be using this one, however, because most of the patients who end up needing an IV in their foot will have veins that are much more difficult overall due to hypotension, hypovolemia, or poor circulation. Remember, feet are dirty and it's important to apply good friction with the alcohol swab to get a really clean area. Depending on which department you work in, you may need an order from a doctor to place an IV in the foot. Patients with a history of diabetes or a recent orthopedic fracture may not be good candidates, and therefore they may benefit from a central line if you're unable to place a peripheral IV in their upper extremities. With the foot, it's very important to allow the area to completely dry before inserting the IV so it doesn't cause a stinging pain. Chances are this patient has been waiting quite some time for an IV placement, so there's no need to rush. This is not a time to wipe the area with a sterile gauze. Once you visibly see the area dry, then it becomes time for the needle insertion. As you can see, I'm gripping his foot with my left hand. You want to find the position that provides you with the greatest view of the vein. You can also use your thumb to pull the skin, making it more taut. Depending on the size of the vein, the foot IVs may not always give you a complete flashback of blood to fill up the tubing like it's doing in this example, even though you are in the vein. This can be due to vasoconstriction, but I commonly find this occurring when I place IVs in the feet with small veins. Sometimes taking off the vacutainer at the end of the tubing allows for the blood to fill up. As you can see here, it did not. If you're worried about the patient moving, you can place the tegaderm on, but if the patient is cooperative, I generally like to completely verify that the IV is good before placing the tegaderm down, because the hairs on the feet are very sensitive and it would be very painful to take it off if it has infiltrated.